Welcome to the IPC webinar, Reporting Health Privacy Breaches. The Office of the Information and Privacy Commissioner of Ontario oversees Ontario's privacy and access laws. This includes the Personal Health Information Protection Act, or PHIPAA, Ontario's health-specific privacy legislation. Personal health information is sensitive. People are protective of personal details related to their medical conditions. At the same time, healthcare providers need this information to care for patients. PHIPAA governs how personal health information is collected, used, and disclosed, creating a consistent approach to protecting health information across the health sector. Under PHIPAA, health information custodians must notify the IPC of a theft, loss, or unauthorized use or disclosure in the circumstances set out in the regulation. Before we move on to the specifics of situations where you must notify the IPC of a privacy breach, a few words about your duty to notify. Under PHIPAA, health information custodians are required at the first reasonable opportunity to notify individuals whose personal health information has been stolen, lost, or used or disclosed without authority. Even in cases where you are not required to notify the IPC about a privacy breach, you have a duty to notify patients. When patients are notified of a breach, they must also be informed of their right to file a privacy complaint with our office. The regulations under PHIPAA set out 7 different categories of health privacy breaches that must be reported to the IPC. They are use or disclosure without authority, stolen information, further use or disclosure without authority after an initial breach, a pattern of similar breaches, disciplinary action against a college member, disciplinary action against a non-college member, and significant breaches. These categories are not mutually exclusive. In some cases, a single privacy breach may fall into more than one of the 7 categories. Let's explore each of these breach situations in more detail. When discussing privacy breaches involving personal health information, it is helpful to first define use or disclosure without authority. Use or disclosure without authority is when personal health information is used or disclosed without consent for purposes not permitted by PHIPAA, or for purposes not permitted by the health information custodian. This can happen when someone who is not involved in a patient's care intentionally looks at an individual's personal health information without a work-related purpose. In some cases, the person snooping in the file could also share the private details they have learned with others. Snooping can be motivated by interpersonal conflicts, curiosity, personal gain, or concern about an individual's health and well-being. Regardless of the motivation, deliberate unauthorized use or disclosure must be reported to the IPC. This is not the case when personal health information is accessed accidentally. Examples of this include emailing patient information to the wrong person by mistake, or placing a letter containing patient information into the wrong envelope. When one-time errors like these occur, you generally do not need to notify the IPC. Unfortunately, some of the most common privacy breaches happen not only when personal health information is lost or mistakenly disclosed, but when it's stolen. A privacy breach resulting from a theft of information is very much as it sounds. Someone has stolen paper files, a laptop, or other devices containing personal health information, or the theft of information is the result of a malicious software attack. These privacy breaches must be reported to the IPC. An exception is when the information that has been stolen is properly encrypted or de-identified to prevent attempts to gain access to the records or identify patients. When information has been protected this way, you do not need to report the breach to the IPC. After a privacy breach has been discovered, additional details concerning the breach may come to light. You may find out that the information from the initial breach has been or will be further used or disclosed without authority. An example is an employee snooping in patient files for the purposes of health care or insurance fraud or marketing services to patients. or when someone accidentally receives a fax containing confidential patient information and then threatens to make it public. In these situations, even if you do not report the initial breach, you must report the situation involving further use or disclosure to the IPC. Sometimes a breach might not seem particularly significant. For instance, think back to our example of faxing a document to the wrong recipient, or accidentally mailing patient information to the wrong person. Mistakes happen from time to time, and on their own, these incidents don't seem to be cause for alarm. It becomes a problem when the same breach issue keeps happening, indicating a pattern of similar breaches that should be reported to the IPC. That's one of the reasons why it's so important to keep detailed breach records. By keeping track of all privacy breaches using a spreadsheet or some other means, it's easier to detect any breach patterns. And once you determine a pattern of privacy breaches is occurring, you must report this to the IPC. You should also take steps to address a pattern of similar breaches. For example, you may need to provide additional training for staff, or tighten up the work processes that are allowing personal health information to slip through the cracks. Tracking all the breaches will not only help you discover breach patterns, it will also help you when it comes time to report your annual privacy breach statistics to the IPC. Reporting these statistics is something we'll talk about in a bit more detail later. In some cases, a healthcare practitioner may be disciplined by an organization they are working for because of a privacy breach. This could include revoking, suspending, or restricting the privileges of a physician. The healthcare practitioner may also choose to resign on their own for reasons that appear to be related to the privacy breach. In situations where you are required to report a healthcare practitioner to the regulatory college because of a privacy breach, you must also notify the IPC. This reporting requirement also applies to healthcare practitioners employed by a board of health. Not all employees with access to personal health information are members of a regulatory college, but similar reporting requirements apply. In the event an unregulated employee is disciplined because of circumstances related to a privacy breach, or they quit and you suspect it is related to the breach, it must be reported to the IPC. So far, we've summarized 6 health privacy breach situations that must be reported to the IPC. Those involving use or disclosure of information without authority, stolen information, further use or disclosure without authority after an initial breach, a pattern of similar breaches, disciplinary action against a college member, and disciplinary action against a non-college member. Most privacy breaches will fall into one or more of these categories. However, if they do not and are otherwise significant, they must be reported to the IPC. In deciding whether a privacy breach is significant, these questions should be considered. Is the information sensitive? Does the breach involve a large volume of information? Does the breach involve many people's information? And is more than one health information custodian or agent responsible for the breach? These are all factors to consider in deciding whether a breach is significant. In general, privacy breaches involving sensitive information that has been made widely available must always be reported to the IPC. Now that you've heard about the 7 types of breaches that should be reported to the IPC, you may be wondering about how to do that. Although you can report breaches to us by mail or fax, we recommend that you use the breach reporting form on our website. It is available by accessing the Health tab on the professional area of our website, choosing Report a Privacy Breach, and then selecting Privacy Breach Report Form from the menu on the left. You'll be asked to provide a description of the breach and the date it happened. You'll also be asked to provide a summary of the steps taken to contain the breach, notify individuals, and investigate the cause. These details can be provided later if they are not available at the time you report the breach. Take care not to include any personal health information in your report. Once we've received your report, someone from our office will follow up with you. You may be asked for additional details about the breach, and the IPC may recommend preventative measures to prevent further breaches. And while we're on the subject of reporting, as mentioned earlier, starting March 1st, 2019, health information custodians will be required to submit an annual report of all privacy breaches occurring in the previous year, beginning January 1st, 2018. When submitting this annual statistical report, you must include all thefts, losses, or unauthorized uses or disclosures of personal health information. This includes health privacy breaches that do not meet the mandatory reporting criteria described in this presentation. When you tally up your breach stats, make sure you don't count each incident more than once. Choose only one reporting category that best fits. For more information on annual reporting and health breach statistics, visit the Health section in the professional area of our website. As a general principle, you may not need to report a breach of personal health information to the IPC at the time it occurs or is detected if it was not intentional, it is a one-time incident, and it is not part of a pattern of breaches. But remember, even if you don't have to report a privacy breach to the IPC, you always have a duty to notify the individuals whose personal health information has been breached and to count all breaches in your annual report. You can visit our website for more information and resources on protecting personal health information and other access and privacy topics. And be sure to subscribe to our YouTube channel for all of our latest videos. Thank you for joining us today. We hope you found this presentation helpful. The IPC is committed to working with healthcare providers to protect patient privacy and improve accountability and transparency in Ontario's healthcare system. Contact us if you'd like additional information about this topic or if you have any questions about access and privacy.